It's my honor to give the presentation today. And thank you for your invitation. First of all, I would like to say that happy Republic Day today. Actually, I have been staying in Bangalore for last 5 years. And now I am feeling that I have become the half Indian, half Japanese. I love this country. I love India. So I'm very happy to celebrate the Republic Day together with you. Thank you. Today I want to introduce our hospital. Name is Sakra World Hospital, and want to brief our the future plan, what we want to move into the future. This is our the hospital. The location is the nearby Bangalore Lake and along the main road of Outer Ring Road. This is the lobby. The very broad and give the very warmth, the expression. So very nicely the design. So I would like to introduce actually the Sakra. So many people are asking to me that what is the name? What is the meaning of Sakra? Actually, Sakra is the blossom. The flower of the cherry blossom in Japanese. If you will visit the Japan in the end of March or the early April, you can see the sakura blossom very beautifully. Actually, the life of the blooming is very short. Around 1 week. After 1 week, this the flower will be vanished, over. But within this the period, only 1 week, this the sakura is showing off their beauty as much as possible. Actually, the Japanese people has the strange, or not the unique, the spiritual sense. That the people seeing, finding the beauty in the vanity of the life. So the Japanese people love the sakura blossom. So we named after sakura. We put the name the sakura on our hospital. Our the medical director is coming from the one of our the partner. The stakeholder name is SECOM. After that I will explain shortly. And another guy name is Lavikesh is taking care of as the COO for operational the matters. We have the center of we are calling the center of excellences for the 6 specialties: the GI, cardiac, the urology, uro and nephrology, orthopedics, and cardiology, and mother and child. These 6 specialties are called the specialty of us. First, I would like to introduce the stakeholders. The major stakeholder is the name is the SECOM. SECOM is not familiar because the SECOM have never entered into India. But this company is the very the big the original business is the security. They are now providing 7 the services, including healthcare. All 7 the service domains are related to the human security. Also, the SECOM is running 18 hospitals in Japan. Actually, this the SECOM hospital group is the second largest private hospital chain in Japan, and they have around 6,000 beds, the strengths. Another the stakeholder is Toyota Tsusho. Toyota Tsusho is the company of distributing, trading company in Toyota Motor Corporation. Actually, they have so many variety of the business field, and the offering the services all over the world. Both two Japanese companies established Sakra World Hospital in 2014, 4 years back. Vision of Sakra. Sakra family serves to enhance quality of life, providing world-class medical care. We put importance the word of family. We aim that our employee and family of the patient also are family member. Such kind of sense we want to enhance in our the hospital. Next, the mission to be #1 hospital in India in patient and employee satisfaction with Indo-Japanese wisdom and passion by 2021. Actually, this is the very challenging the objective for us actually, but we are aiming to become such to develop such the hospital. Okay, from now, I would like to share our the feature of Sakra. I want to explain about the clinical collaboration with the Indian, the Japanese, the hospital, the healthcare institute, and training areas and Kaizen. Kaizen, right? The Toyota is the said as the king of Kaizen. So we are introducing the Toyota Kaizen way for the hospital operation. We are now conducting several the Indo-Japanese clinical collaborations. First of all, I would like to say that Sakra World Hospital entered the clinical collaboration, the engagement with Hokkaido University. Hokkaido University is one of the very, the primary government, the Japanese government hospital. So we engaged for the comprehensive the way of the exchange of the people, or the joint research, or the so on. Especially neurosurgery, we are doing joint research, and the TV, the webinar, conference. And the joint cadaver course we conducted actually 2 years back, and this year also we will do, and exchange training program. 2015 November we conducted the Indo-Japanese neurosurgical cadaver course. We borrowed the laboratory in MS Ramaiah Medical University. Actually, as you know, they have the excellent the laboratory where we can do we can conduct the cadaver the session. At that time, the 20 Japanese the doctors participated. And the 10 other local doctors attended in our the joint cadaver courses. unfortunately, in Japan, in law, the cadaver is not allowed. So so many doctors are willing to come to join this the cadaver course. But we only have the 30 seats. So so many the doctor could not join attend this the previous time. So we are thinking that this November we will conduct again the second Indo-Japanese cadaver course. So we will invite the doctors who could not attend in the previous timing. We have the excellent two excellent doctors in neurosurgery. The name is Dr. Satish and Dr. Swaroop. They were invited by Hokkaido University, and the Hokkaido University gave the visiting professor to them. And this photo is showing the inauguration of this the visiting the professor and the honorable lecture has been conducted in this date. Actually, the Hokkaido University is willing to have willing to send their doctor to Sakra World Hospital, because these two doctors are conducting very, very immense the number of the surgery. And we developed the fellowship program for Hokkaido University doctors. The duration would be 6 months to 1 year. The course we specified 4 areas like this. Actually, they are conducting approximately 1,500 surgeries in a year. So they are willing, because if we'll see a number of cases in Hokkaido University, they are conducting only 300 per year. So the training opportunity would be restricted. So now. From this year, April, the one senior resident from Hokkaido University will be coming to get the opportunity to have that training under 2 doctors. Fortunately, for the Japanese doctors, the MCI give the 1 year the duration, the temporary license for conducting clinical the procedures. So they can, the resident can get the hands-on training from these doctors. And we are doing the annual joint Indo-Japanese knee course specifically for focusing on the knee surgeries. The last month, in December, we conducted this, the annual conference for the subject of the TKA, the robotic TKA, and the computer-assisted TKA. Actually, so many doctors participated and gave the lecture for this the session. And the Japanese doctor also came from Hokkaido University. Actually, another one I would like to introduce. Nowadays, for aortic valve reconstruction will be conducted by using the consumables, artificial consumables. Artificial valve, the mechanical valve and the tissue valves. This is costing around the 50,000 to the 1.5 lakhs. It's very, very expensive. But one the Japanese doctor, name is Dr. Ozaki, invented the very, very new way of this the reconstruction. Dr. Ozaki did is conducting by using patient's pericardium. Once the surgeon will extract the patient's pericardium, and the surgeon will pick up the cusps by measuring the patient's the size of the cusps. Then the suturing these the cusps. This cost is zero. So so many and this the procedure would be applicable for the child also. Actually, the current the artificial the valve cannot be applicable for the child. So we can do the aortic valve reconstruction with very the cheap, affordable the price, and we can extend the scope of application of this the procedure. Our the cardiac surgeon trained under Dr. Ozaki last year, and in coming February, Dr. Ozaki will be coming to Sakra to conduct this the procedure, and the several the external doctor will come to see this procedure. Another aspect, nursing. Actually, we have the two Japanese nurses in the system, and they are planning and conducting the training for nurses, our local the nurses. One the person name is Ms. Pushpa. She is the deputy director of nursing, we send her to one of the SECOM hospital to get the training. Basically, the shadowing is the major way of training. But after the training, the Pushpa, she found so many the findings that should be applied in Sakra World Hospital. Actually, they found the 130 the findings. So we want to apply her the findings to Sakra for improving the nursing services. But on the contrary, the last day she analyzed, she presented, she gave the presentation of her thought. That is the showing she analyzed 120 the findings with the very the neatly and analytical way, and she presented her idea as an annual plan to implement in Sakra World Hospital. Then the audience who are the management of this the hospital were very much astonished to see her the analytic sense and the planning sense. So I found that such the exchange will give the mutual benefit for the both institute, I believe. So we have a plan that the yearly 4 nurses we will send to Japanese hospital. In this year, we are thinking that the 2 critical area ICU nurses and 2 management the nurses will be sent to Japanese the hospital to get the findings. So we want to make the Indo-Japanese the unique nursing the system actually. 5S. we are every day doing the five years the activities. This is showing the photo is showing the scene of our store. As you see, very much messy there. But after that, the person who from the Toyota, did the Kaizen, 5 years program, the activities. Then the materials would be neatly placed. This also, before that, there's so many materials, put on the rack. But this guy did the improvement in the 5 years activities. Other Kaizen activities. We did model world two the projects. One is model world project. We first we focused on the one word for 2 months to to improve. And we found so many the issues. 14 problems has been found out. So then we did develop the solution, and the 14 problems would be sorted out. Then after that, expand, replicate to the other words for us the next 4 months like this. OT Kaizen project, Operation Theater, we also have the 19 programs. So we did focus on for 4 months, and by using the Toyota way of Kaizen, we improved so many. In Model World project, we did several matters. For instance, this is the I'll show for the improvement. Discharge the time. Also, the before 146 will become the 90 minutes. Such way, the all indicator KPI has been measured before and after, and the improvement can be shown. So I will introduce our strategy. This is the Japanese typical the healthcare system. Japanese, all of the Japanese residents are covered by the Japanese governmental insurance. So the only 10% or 20% of the treatment cost has to be paid from the individual wallet. Especially the Japanese government is enhancing for these areas the rehabilitation and visiting care the facilities, because they found that rehabilitation and the home care services will bring the cost of the medical cost so much. So they developed a very, very comprehensive manner and the maturity there. So the all functionality, all the function of the facilities would be connecting with the information and the gather to help support the human life. Actually, especially rehabilitation, Japanese government conducting yearly the national wide survey for the result contribution of rehabilitation intervention. They are using the BI and film for measuring the ADL, and for these the indicator would be improving after intervention of rehabilitation. And as you know, this is the statistics of in India. The burden of cancer is the growing up. This is showing the opportunity of life save in India in compare with the other advanced countries. Actually, we are thinking. Of course, you also have the same opinion that the accessibility from home to the cancer treatment the facility would be necessary. Especially rural area would be the facing the very very severe shortage in the treatment of cancer. So we have some know-how. We can bring some know-how from Japan for especially the home care services and tertiary care the services and rehabilitation. Our idea is we want to expand our bed strengths. Now we have 350 the bed strengths. But we should become at least 500 beds hospital to conduct the very advanced tertiary care, like the advanced emergency and the comprehensive cancer treatment. And of course, we should become the teaching hospital, and the research activities has to be conducted. Simultaneously, we are thinking to develop the hub and spoke model. We want to develop peripheral of the Bangalore, the family health center. These functionality would be the primary care, and after discharge from the Sakra World Hospital, we have to ensure the continuous care nearby the patient's home. This is our the idea. Actually, in India also the very beautifully for instance the HCG is doing very beautifully. So this like the HCG, we should develop such the hub and spoke model for the ensuring and doing the continuous care. So we are thinking we want to develop the healthcare system. We don't want to develop the tertiary care hospital only. Our idea is the simple, the Indo-Japanese the unique healthcare system we have to develop. Thank you so much.